Patients with kidney disease are advised to take precautions if they choose to fast during the holy month of Ramadan. Chronic kidney disease (CKD), a long-term condition involving the gradual loss of kidney function, can be categorized into 5 stages based on severity. Number 1, the category of severity of a patient's kidney disease can indicate if he or she will be able to fast safely. For instance, patients with acute kidney failure should not fast until they fully recover. However, CKD patients have different stages of nephropathy, kidney disease, and patients diagnosed with stage 3 CKD or higher are advised not to fast as their kidneys fail to retain normal rates of body fluids, making them susceptible to further renal dysfunction and renal damage. Number 2, abstaining from food and water for long hours can lead to dehydration. CKD patients should consult their physician to assess the severity of their condition and the potential risks associated with fasting. Number 3, hemodialysis, a type of renal replacement therapy. Patients typically undergo dialysis 3 times per week and cannot fast due to IV fluid intake during the procedure. However, these patients can fast during the rest of the week. Kidney transplant patients are also advised to refrain from fasting due to their need to comply with their prescribed medication dosages and times. As many kidney transplant patients are diabetic, fasting may have a negative impact on their health. Therefore, it is imperative that these patients consult their physician before they decide to fast. Number 4, patients with kidney disease must consult their dietitian in order to ensure adequate protection against potential complications while fasting. Kidney disease patients tend to overlook the importance of maintaining a healthy and balanced diet while fasting. Number 5, kidney disease patients should not skip sahur, pre-dawn meal, to avoid body weakness, bearing in mind that they need more calories than individuals in good health. Kidney disease patients should be on guard not to ingest high quantities of sodium, potassium and phosphorus, especially during Ramadan. Sodium is abundantly contained in table salt, as is potassium in some vegetables such as tomatoes, potatoes, okra and green leafy veggies, as well as some fruits, including bananas, oranges, mangoes, dates, apricots, peaches and cantaloupe. Phosphorus is found in beans, carbonated drinks, nuts and dairy products. Patients who are on phosphorus-lowering medications should take their pills during meals, not before or after eating. Number 6, each kidney disease has its own dietary requirement for Ramadan. If physicians approve fasting for pre-dialysis kidney patients, they should maintain a diet low in protein-rich foods to avoid imposing an extra burden on their kidneys that could lead to complete renal failure and increase urea in their system. On the contrary, dialysis patients need to increase their protein intake, especially animal proteins, in order to compensate for the protein lost during the dialysis process. Number 7, pre-dialysis kidney patients should drink 2 to 3 liters of fluid per day if the volume of urine they pass is within the normal rate. Otherwise, they should reduce their fluid intake to avoid water retention that could affect the heart and lungs. Number 8, hemodialysis patients should be careful not to drink more than 1 liter of water, fluid daily after iftar to prevent water retention that would otherwise affect their heart and lungs. Peritoneal dialysis patients can drink up to 2 liters of water daily, depending on the amount of fluid discarded in the dialysis process. They should be aware of the quantities of fluid they consume and reduce their intake of sweets and fatty foods, as they are more prone to cardiovascular diseases. Kidney disease patients should avoid spending significant time outside in high temperatures when they are fasting, adding they should also avoid eating salty foods. Please subscribe my channel.